More than 80 participants from the region and overseas gathered here to brainstorm on bringing to action the regional framework for change on implementations of the End-TB strategy. Endorsed last year in the 66th Regional Committee for the Western Pacific, the framework adapts the global End-TB strategy, calls for bolder national efforts in fulfilling the vision of zero death by TB come 2030.
This meeting is an opportunity for Pacific TB program managers and decision makers to work together for better outcomes for their respective populations and for our region. That will require bold decisions, and it will require resolutions that are not just committed to paper, but resolutions which actually drive the adoption of cost-effective and innovative approaches.
Studies have shown TB to disproportionately affect vulnerable populations such as the young and elderly in underprivileged and remote communities, and there are a number of challenges for the Pacific Island countries and territories in order to effectively control the epidemic.
TB is a kind of a litmus test of the broader development concerns in a country or a region. For example, in many countries, TB is associated with poverty, with issues of poor nutrition, poor housing, poor access to quality services, including health and education.
World Health Organization reports that many people with TB still go undiagnosed, especially among the poor, marginalized, and mobile groups, making TB difficult to detect and cure.
Stigma, discrimination, and financial burden associated with TB have devastated families throughout the region. Basic TB services are free in nearly all countries. However, patients continue to suffer a heavy financial burden from lost income and other expenses. So these challenges are serious, but we can overcome them by working together, adapting innovations, and dynamically responding to the changing environment.
The meeting featured sessions aimed at addressing these challenges and exploring emerging issues in TB response, including controlling the disease among high-risk populations and strengthening research and innovation. Jesse Tisinu, Fijuan News.